Ladies and gentlemen, diabetes is one of the fastest growing health problems in the world, yet millions of people still do not realize they may already have it. The frightening truth is that diabetes often develops silently. Many people feel normal, while high blood sugar slowly damages nerves, blood vessels, and organs inside the body. According to doctors, some of the earliest and most important warning signs can appear in one place most people rarely pay close attention to: the feet. Your feet may reveal hidden health problems long before a doctor officially diagnoses diabetes. Unfortunately, many individuals ignore these symptoms because they believe they are caused by aging, tiredness, standing too long, or poor shoes. But doctors continue warning that unusual changes in the feet should never be dismissed casually, because they may signal dangerous blood sugar problems already affecting the body. One of the most common warning signs doctors talk about is tingling or numbness in the feet. Many people describe it as pins and needles, buzzing sensations, or feeling like the feet are asleep even while walking. This happens because high blood sugar can slowly damage nerves over time. At first, the sensation may come and go occasionally, especially at night, but as diabetes progresses, it can become constant. Some people lose sensation completely in certain areas of the feet. This is extremely dangerous because pain normally protects the body from injury. A person with nerve damage may step on something sharp, develop a blister, or suffer a cut without even realizing it. Small, unnoticed injuries can then become infected and difficult to heal. Doctors also warn about burning pain in the feet, especially during nighttime. Some individuals describe the sensation as walking on hot sand or having fire underneath the skin. Others experience sharp stabbing pains that interrupt sleep. These symptoms often result from damaged nerves sending abnormal pain signals to the brain. The pain may start mildly, but gradually become severe enough to affect daily life. Many people mistake the problem for fatigue or poor circulation, but persistent burning sensations should never be ignored because they may be one of the earliest signs of diabetic nerve damage. Another important warning sign is dry, cracked skin on the feet. Diabetes can affect the nerves responsible for controlling moisture and oil production in the skin. As a result, the feet may become rough, flaky, and extremely dry. Cracks often form around the heels and toes. While many assume this is simply caused by weather or aging, doctors warn that deep cracks can become dangerous entry points for bacteria. Because diabetes weakens healing ability, even small skin breaks may develop into serious infections if left untreated. Swelling in the feet and ankles is another symptom that deserves attention. Some individuals notice their shoes suddenly feel tighter or leave deep marks around the ankles. Swelling may happen because diabetes can damage circulation and affect how the body handles fluids. In some cases, swelling may indicate infection or inflammation occurring beneath the skin. Doctors emphasize that persistent swelling, especially when combined with numbness or pain, should be evaluated as soon as possible. Slow healing wounds are among the strongest warning signs associated with diabetes. Normally, small cuts or blisters heal relatively quickly, but when blood sugar levels remain high, the body struggles to repair damaged tissues properly. A tiny wound on the foot may stay open for weeks, or even worsen over time. Poor circulation and weakened immunity make it harder for the body to fight infection and deliver nutrients needed for healing. Many people first discover they have diabetes after seeking treatment for foot wounds that refuse to heal. Doctors also warn about changes in skin color or temperature. Some people notice their feet becoming unusually pale, reddish, bluish, or darker in certain areas. Others feel their feet are constantly cold, even in warm weather. Diabetes can damage blood vessels and reduce circulation, preventing enough oxygen-rich blood from reaching the feet. Poor blood flow not only changes appearance, but also increases the risk of tissue damage and ulcers. In severe cases, reduced circulation may lead to serious complications, requiring emergency medical care. Frequent fungal infections between the toes or around the toenails can also signal diabetes. High blood sugar creates an environment where fungi and bacteria thrive more easily. Conditions such as athlete's foot, itching, redness, peeling skin, or thick yellow toenails may occur repeatedly. Some people treat these infections again and again without realizing uncontrolled blood sugar may be contributing to the problem. Doctors often recommend blood sugar testing when stubborn fungal infections continue returning. Another overlooked symptom is unusual foot odor. Persistent unpleasant smell that does not improve with washing may indicate bacterial or fungal infections. Diabetes weakens the immune system, making infections more common and harder to control. In some cases, wounds hidden beneath the skin can produce odor before other serious symptoms become obvious. Ignoring these signs may allow infections to spread deeper into tissues and bones. Balance problems and changes in walking patterns can also develop as diabetes affects the nerves and muscles in the feet. Some individuals begin stumbling more often or feel unstable while walking. Others notice changes in foot shape, curling toes, or weakened muscles. The feet constantly send signals to the brain about movement and body position. When nerve damage interferes with these signals, coordination suffers. Doctors warn that falls become much more common when diabetic nerve damage progresses. One especially dangerous complication doctors discuss is diabetic foot ulcers. These open sores usually develop from small unnoticed injuries combined with poor healing and pressure on the feet. Ulcers often appear on the bottom of the foot, heel, or toes. At first they may look minor, but they can quickly become infected. Severe infections may spread into deeper tissues and bones, sometimes leading to hospitalization or even amputation. Early treatment is critical because delayed care greatly increases the danger. Many people with diabetes also experience muscle cramps in the feet or calves, especially at night. Poor circulation and nerve problems can trigger painful tightening of the muscles. Some individuals wake suddenly from sleep with intense cramping that forces them to stretch or walk around. Repeated cramps may indicate circulation problems developing silently inside the body. Doctors constantly remind patients that diabetes affects far more than blood sugar levels alone. The disease can damage nerves, blood vessels, kidneys, eyes, heart, and immune function over time. The feet often become one of the first places where these internal problems become visible because they are located farthest from the heart and rely heavily on healthy circulation and nerve function. One reason diabetic foot problems become so dangerous is because many people ignore early symptoms. Tingling may seem harmless at first. Dry skin may appear unimportant. A small blister may not seem serious. But diabetes slowly reduces the body's ability to heal and protect itself. Small problems can turn into severe infections much faster than most people realize. Doctors recommend checking the feet daily, especially for adults over 40 or individuals with family histories of diabetes. Looking carefully for cuts, swelling, redness, blisters, color changes, or nail problems can help detect issues early. Proper foot care is not only about comfort or appearance, it can literally prevent life-threatening complications. Wearing proper footwear is also extremely important. Tight shoes, rough seams, or uncomfortable sandals can create pressure points and injuries. People with diabetes may not feel developing blisters because of nerve damage. Doctors recommend supportive shoes that fit properly and protect the feet from unnecessary friction and injury. Lifestyle habits play a major role in preventing diabetic complications. Healthy eating, regular exercise, maintaining a healthy weight, drinking enough water, and controlling blood sugar levels all help protect the nerves and blood vessels. Smoking is particularly dangerous because it severely damages circulation and increases the risk of foot ulcers and amputations. Many individuals assume diabetes only affects older adults, but doctors are increasingly diagnosing younger people due to poor diets, obesity, and inactive lifestyles. Early symptoms in the feet can appear long before diagnosis, regardless of age. This is why awareness matters so much. The emotional impact of diabetic foot problems can also be serious. Chronic pain, reduced mobility, fear of complications, and repeated infections can affect mental health and quality of life. Some people become afraid to walk long distances or participate in activities they once enjoyed. Early detection and proper management can prevent many of these difficulties. One of the most important messages doctors continue repeating is simple. Simikini. Never ignore persistent changes in your feet. The body often whispers before it screams. Tingling, burning pain, numbness, swelling, dry skin, slow healing wounds, infections, discoloration, cold feet, and balance problems may all be signs that diabetes is already affecting the body silently. The good news is that early diagnosis can make an enormous difference. Many people successfully manage diabetes through lifestyle changes, medical treatment, proper nutrition, and regular monitoring. Catching the condition early greatly reduces the risk of severe nerve damage, kidney disease, blindness, heart problems, and amputations. Your feet carry you through life every single day, but they may also be carrying an important warning about your health. Paying attention to unusual symptoms today could help protect your future tomorrow. Doctors continue warning that ignoring these early signs may allow diabetes to continue damaging the body silently. until much more serious complications appear. Many doctors say one of the greatest dangers of diabetes is how ordinary the early symptoms can seem. A person may notice mild tingling once in a while, or occasional dryness in the feet, and never imagine it could be connected to blood sugar problems. Because the symptoms usually develop slowly, people adapt to them over time instead of recognizing them as warnings. This silent progression allows diabetes to continue damaging nerves and blood vessels for years, before diagnosis finally happens. Some individuals begin feeling extreme sensitivity in their feet. Even the touch of bedsheets at night may feel painful or irritating. Doctors explain that damaged nerves can become confused and overly reactive. Normal sensations suddenly feel uncomfortable or intense. Walking barefoot may become unpleasant, and wearing shoes for long periods may feel painful even without visible injuries. This abnormal sensitivity can seriously affect daily life and reduce mobility over time. Others experience the complete opposite problem and lose sensation almost entirely. They may not feel cuts, burns, blisters, or pressure injuries at all. Doctors warn that this loss of feeling is one of the most dangerous complications because injuries can worsen silently without treatment. A tiny blister caused by a shoe may turn into a deep ulcer before the person even realizes there is a problem. This is why regular foot inspection becomes extremely important for anyone at risk of diabetes. Changes in toenails are another warning sign many people overlook. Thickened nails, yellow discoloration, brittleness, crumbling edges, or nails separating from the skin may signal circulation problems or fungal infections linked to diabetes. Because the immune system becomes weaker when blood sugar remains uncontrolled, fungal infections often become more frequent and harder to eliminate completely. Some individuals repeatedly treat nail infections without understanding the deeper health issue contributing to them. Doctors also warn about excessive sweating or unusual dryness in the feet. Diabetes can damage autonomic nerves that regulate moisture production. Some people develop feet that are constantly damp, while others experience extremely dry skin that cracks easily. Both conditions increase infection risk. Excess moisture creates a breeding ground for fungus and bacteria, while dry, cracked skin allows germs to enter through broken areas. Another symptom people often ignore is persistent itching in the feet or lower legs. High blood sugar can contribute to dry skin, poor circulation, and fungal growth, all of which may cause irritation. Many individuals assume itching is caused by allergies or weather changes, but doctors warn that chronic itching combined with other symptoms deserves medical attention. Some individuals with early diabetes notice strange crawling or electric sensations inside the feet. These abnormal nerve signals may feel like insects moving beneath the skin, or sudden electric shock shooting through the toes. While these sensations may seem unusual, they are common signs of nerve damage developing silently. Doctors emphasize that the nervous system is highly sensitive to elevated blood sugar levels over long periods. Foot fatigue is another hidden clue doctors frequently mention. People with circulation problems may notice their feet become tired, heavy, or sore after even short periods of standing or walking. Reduced blood flow means muscles and tissues receive less oxygen and nutrients. Over time, this can lead to weakness and reduced endurance. Some individuals gradually limit their movement without realizing diabetes-related circulation issues may be involved. Doctors are particularly concerned when people develop recurring foot infections. Small cuts that repeatedly become red, swollen, or painful may indicate the immune system is struggling to fight bacteria properly. High blood sugar weakens immune defenses and creates an environment where infections grow more easily. Even seemingly minor infections should never be ignored because they can spread quickly in diabetic individuals. One serious condition doctors warn about is Charcot foot, a rare but dangerous complication of severe diabetic nerve damage. In this condition, weakened bones and joints in the foot begin breaking down due to unnoticed injuries and loss of sensation. The foot may become swollen, warm, red, and deformed over time. Because pain sensation is reduced, people may continue walking on injured bones without realizing the damage occurring. Early diagnosis is critical to prevent permanent deformity. Another major warning sign is persistent redness in certain areas of the feet. Red spots may indicate pressure points, irritation, infection, or circulation problems. If redness does not improve quickly or becomes warm and swollen, medical evaluation is important. Diabetes-related circulation issues can allow small areas of irritation to progress into serious tissue damage much faster than normal. Doctors often explain that healthy circulation is essential for every part of the body, but the feet are especially vulnerable because they are farthest from the heart. Tiny blood vessels in the feet can become damaged from years of elevated blood sugar. As circulation worsens, healing slows, tissues weaken, and nerves lose proper function. This combination creates a dangerous environment where small problems become major complications. One overlooked symptom connected to diabetes is darkened skin around the ankles or feet. Poor circulation and chronic inflammation may cause patches of darker skin to appear over time. Some individuals also notice shiny, thin skin with reduced hair growth on the feet and lower legs. These changes can signal blood vessel damage and reduced oxygen supply to tissues. Doctors stress that foot pain should never automatically be blamed on aging. Many people assume discomfort is simply part of getting older, especially after years of work and physical activity. However, persistent numbness, burning, tingling, or swelling may reflect nerve and circulation problems that deserve proper medical testing. Early diagnosis allows treatment before severe damage develops. Sleep problems are also common among individuals with diabetic nerve pain. Burning sensations, cramps, and sharp pains often become worse at night, making restful sleep difficult. Poor sleep then worsens blood sugar control and increases fatigue during the day. Doctors describe this as another dangerous cycle where diabetes symptoms continue feeding into one another. Obesity greatly increases the risk of diabetic foot complications because extra body weight places more pressure on the feet while also increasing insulin resistance. Over time, this strain contributes to inflammation, circulation problems, and joint stress. Doctors encourage gradual healthy weight management because even moderate improvements can reduce blood sugar levels and protect the feet. Smoking is one of the worst habits for diabetic circulation. Cigarettes damage blood vessels and reduce oxygen delivery throughout the body. In people with diabetes, smoking dramatically increases the risk of ulcers, infections, and amputations. Doctors strongly warn that continuing to smoke while diabetic foot symptoms are present can rapidly worsen complications. Hydration also matters more than many people realize. Chronic dehydration can worsen circulation and skin dryness. Drinking enough water supports blood flow and helps maintain healthier skin integrity. Sugary beverages, however, can worsen blood sugar problems and contribute to further damage. Doctors often recommend simple daily habits that can greatly reduce risk. Washing the feet gently, drying carefully between the toes, moisturizing dry areas, trimming nails properly, and checking for injuries every day can prevent serious complications. People with diabetes should also avoid walking barefoot because unnoticed injuries can quickly become dangerous. Family history remains an important risk factor. Individuals with parents or siblings who have diabetes should pay close attention to changes in their feet and overall health. Genetics can increase susceptibility, especially when combined with poor diet and lack of exercise. One alarming reality is that millions of people remain undiagnosed for years. During that time, nerve damage and circulation problems may continue progressing silently. Many only discover the disease after severe symptoms appear, such as infected ulcers or major loss of sensation. This is why doctors constantly emphasize awareness and early screening. Healthy eating plays a major role in prevention and management. Diets rich in vegetables, fiber, lean proteins, and healthy fats help stabilize blood sugar and reduce inflammation. On the other hand, excessive processed foods, sugary snacks, and refined carbohydrates place constant stress on the body. Every meal either supports healing or contributes to further damage. Exercise improves circulation, insulin sensitivity, and overall metabolic health. Even moderate daily movement can strengthen blood flow to the feet and help protect nerves from damage. Doctors encourage consistency rather than extreme workouts because long-term habits create the greatest benefits. The emotional side of diabetic complications should not be ignored either. Chronic pain, mobility limitations, and fear of amputation can create anxiety and depression. Many people feel isolated or frustrated as symptoms progress. Support from healthcare providers, family, and lifestyle improvements can help individuals maintain both physical and emotional well-being. Doctors continue repeating one critical message. The feet often reveal diabetes before other parts of the body do. Tingling, burning pain, swelling, infections, discoloration, slow healing wounds, cold sensations, balance problems, and skin changes are not symptoms to ignore. The body sends warnings long before a major crisis develops. Paying attention to these early signs may help prevent devastating complications later. Diabetes does not damage the body overnight. It happens slowly, silently, and steadily. But with awareness, proper care, healthy habits, and early medical attention, many people can successfully protect their feet, their mobility, and their long-term health.